name is Edem Amedzro. I'm a medical sonographer by profession. This is the Sonochatter show where we talk all about medical ultrasound and how it can be of benefit to you. Thank you so much for staying with me. For those who watched my very first episode, I really appreciate you taking your time to do so. For those who shared, for those who liked, those who commented, thank you so much. Those who subscribed to the channel, I really appreciate it. Those who tried to answer the giveaway question and failed terribly at it too, I really appreciate it. I wish you better luck next time. Now, I promised that I was going to talk about some of the disadvantages of medical ultrasound in today's episode, and I'll talk about some of the misconceptions of medical ultrasound in today's episode. So stay with me, and I hope you learned something from today. I'll be right back. Ultrasound is the one that is used for pregnant women, right? It's only pregnant women that can get ultrasound scans. No, ultrasound scans have a wide range of uses. Thank you so much for staying with me. Now, the very first disadvantage of ultrasound I'd like to talk about is that it is very operator dependent. Now, what I mean by this is that when you're having an ultrasound scan, the quality of it or the quality of the report you are going to get in the end depends on the knowledge, the skill and experience that your ultrasound practitioner is bringing on board, whether it be the sonographer, the radiologist, or anyone who is taking that scan at any point in time, is the one going to determine how quality your scan is going to be. Their knowledge, their skill, their experience is what they'll use to give you a report from the scan. Now, this works as an advantage as well, such that if you meet someone who is very experienced, who is very well trained, like those from KNUST, you can trust that they'll deliver quality job and give you a very good report that aids your doctor in being able to manage you. Now, another disadvantage is that it is also patient dependent to a large extent. Now, what I mean by this is there are certain procedures that require that the patient also complies with certain instructions to be able to help the sonographer take good scans. For instance, in the abdominal scan or even in Doppler scans, you can ask the patient to take in a deep breath out and they breathe out. Now, for some patients, due to certain physical challenges or medical conditions, are not able to comply with these instructions, and it doesn't help the scan. What it does is that it either limits the quality of the images that comes out, or even sometimes we might not be able to perform the procedure at all if those things are present. Now, we all know that if you can weaken Superman with kryptonite, and Iron Man is only Iron Man so long as he has a suit on. If you take the suit off, he's just Tony Stark. He can only do so much.
Friday?
We have some weapon systems offline.
Hey, what?
Now, if you put gas or air in the way of ultrasound, it cannot do anything for you. That is why we put a gel on your skin to be able to allow the ultrasound waves to pass through. In subsequent episodes, I'll talk more about the gel and its significance in ultrasound imaging. But then, that is one of the reasons why ultrasound is not good for imaging the bowel loops or the intestines or imaging the lungs, because of the amount of gas those organs are filled with. Now, ultrasound also is not able to be used for a bone imaging because ultrasound waves cannot go through the bone, so you cannot use ultrasound to image the bones. That does it for some of the disadvantages of medical ultrasound. I think that ultrasound is the greatest medical imaging modality available to man right now, but it's only fair that I share a few disadvantages. Now, I'll move on to talk about some of the misconceptions of medical ultrasound. The very first one of them being, only pregnant women get ultrasound scans. No! Ultrasound scans have a very wide range of uses. Like I mentioned in the very first video, it's used for the thyroid, it's used for the breast, it's used for the scrotum, it's used for image the blood vessels in the legs and in the arms and even in the neck. So ultrasound has a wide range of uses. It's not only for pregnant women. Though it is the best example, if you are trying to explain ultrasound to someone and you don't understand, you can just tell them, oh, the one they use for pregnant women. But it has many other uses. It's not only for pregnant women. Another misconception is that, oh, I have to drink water or fast for every procedure. No, it's not true. You only fast when it is an abdominal scan, because if you eat sometimes shortly before the examination, some of the bowel loops get filled with a lot of gas, which do not help images, or sometimes also the gallbladder contracts and it doesn't help. You might not be able to see what is in there to be able to make a diagnosis. That's why we ask that you fast before the scan if it is an abdominal scan. Or if it is a pelvic scan, we may ask that you drink some water so that you have urine in your bladder for the images. Now I'll explain that also in subsequent episodes, the reason why you should have urine in your bladder for some of the ultrasound procedures. So if it is not a pelvic scan or abdominal scan, feel free and eat or drink water at your own pleasure, or if you feel like it, just go ahead and do it. It doesn't have anything to do with it if it is not an abdominal or pelvic examination. Now another misconception about medical ultrasound is that, oh, it's a very fast procedure. The last time my sister had it, it was very, very, very fast. Why is mine taking so long? No, there are certain various time allocations for various different types of medical ultrasound procedures. They don't all take the same time. So an abdominal scan might not take as long as a Doppler scan, and so on and so forth. Different ultrasound scans have different time allocations for them. That does it for a few of the misconceptions of medical ultrasound. If you still have some questions or some misconceptions that you want to be addressed, you can send me an email at mavinedem@gmail.com, or you can send me a WhatsApp message or even call me on 0503 888 999. You can also follow me on all the social media platforms. I'm there as MavinEdem. You can send me your questions or suggestions, recommendations, reviews, criticisms, etc. and I'll work on all of them. Now, at this stage, I'd like to encourage you to subscribe to my YouTube channel by clicking the subscribe button below. I'm going to give you a second to do that. Thank you so much. Now, make sure to click on the notification bell so that every time I post, you'll be notified of it. Now, if you have learned something from this video, if you have enjoyed watching the video, share with someone, like the video, and share some few comments on it to let me know what you think or what you want to see next. Thank you so much for staying with me in this episode of Sonochatter. In the next episode of Sonochatter, I'll be telling you about the basics of an ultrasound machine and a basic ultrasound room setup, what you see and what you will not see, so that you don't get scared when your doctor asks for an ultrasound scan. You go, I'm going into a certain room, what's going to happen to me? What are they going to put on me? We are going to settle all those things so that you don't have any fears when you're asked to do an ultrasound scan. Once again, thank you so much for joining me. See you in the next episode. Bye.